Good evening, everyone. I'm glad you decided to spend this evening with us. Before we begin our webinar, please let me know that you can hear me loud and clear. Let me know in the chat section, so then we can start. Yes, okay. You can hear me. Fantastic. Thank you for the feedback. Okay. I'm your host, Dorothy. Welcome to IVF webinars. Egg Donation Friends and our project IVF Webinars is an online space for patients where they can connect and interact with IVF experts from all over the world. All our webinars are recorded and they are available to watch for free and on demand at eggdonationfriends.com/IVF-webinars. IVF webinars are brought to you with the help of partners, National Fertility Society, fertility clinics abroad, and Donor Conception Network. Today, we are here with our guest, Dr. Carmen Avilés Salas, and she will be talking today about IVF and lesbian couples, a Ropa method in Spain. Hello, Dr. Carmen.
Hello, Dorothy. How are you?
I'm fine. How are you?
Fine, thank you.
Okay, let me just add that the presentation will take about 20-30 minutes. And after the presentation, you all will be able to ask your questions and Dr. Carmen will answer them. Okay, I think we are ready to start.
Perfect. So thank you very much to your attending tonight. I'm going to talk about the IVF and lesbian couples ROPI method in Spain. Okay. What does ROPI method means? ROPI stands for a reception of oocytes from the partner. The Ropa method is a variant of in vitro fertilization treatment. This technique allows the couple formed by two women to share the process of in vitro fertilization in an active way. In that process, one of the women can be or will be the genetical mother who provides the eggs, and the other one will be the biological mother who gets the who carries the pregnancy. Both women can actively participate in the process in order to achieve a full-term pregnancy and a healthy baby at home. Which are the requirements? The legal status of lesbian shared biological mother in Spain needs that the female couple be married to can start a Ropa procedure. According to the law currently enforced in Spain, women shall be able to use their reproductive techniques regardless their marital status and their sexual orientation. In that way, women's right to motherhood is reinforced, and what is more important, not only for reasons having to do with fertility. It's important that couples are married because in Spain, donation is anonymous. The only exception is in heterosexual couples where the man donate his sperm to his wife. In that way, as a man donates his sperm to his wife, in a lesbian couple, one of the women can donate her eggs to the other one to the other woman without anonymous, and it can be legal. Since 2007, lesbian shared biological motherhood has been legally recognized in Spain. Consequently, babies that are born through a Ropa technique within a lesbian married couple have two legal mothers. This is in that way if and when they are married. Because of the, as I have said, the anonymatus, the donation is anonymous in Spain, so only in the part of a couple, the donation is not anonymous. We need a performance study of the couple. We need to know the ovarian reserve, the quality of the eggs, the state of the uterus of both of the women, to advise them who is the best to be the donor and who is the best to be the receptor. Both women need to perform a blood test to be sure that they don't have any infective disease and a karyotype. And depending on the ovarian reserve and the quality, we will advise them to who should be the donor. We usually prefer that the younger woman be the donor because usually they have a better ovarian reserve and better egg quality. Not all the couples have the same reasons to start with this technique. Same-sex female couples who wish share a motherhood and an active and become an active participants in the reproductive process can decide to start with a Ropa method, but sometimes there are medical reasons. Some of the one of the women of the couple may have alteration in her oocyte quality, absence or oocytes, or several ovarian dysfunction. Some of them can have a risk of hereditary transmission of any disease or chromosomal or genetic abnormalities. And some others have a failure of previous fertility treatment. So in all of these cases, if the other woman of the couple have a good reserve, it can be that woman can be the donor, and the other woman who have some medical alteration or reduced ovarian reserve can carry the pregnancy, and then all of them will be will have an active participation in the treatment. Okay. What does the Ropa technique involve? Well, one of the women is going to make or undergoes an ovarian stimulation, and the other one receives the embryos and carries the pregnancy. As we have two women, we will need sperm from a donor, okay? As I have said, the donation in Spain is anonymous, so nor the women on the couple nor neither the donor will know each other in any moment. To select the donor, as you have, as you know, the donation is anonymous, and we select the donor regarding the physical characteristics, ensuring maximum physical similarity with the donor, with the woman who will receive the eggs. All the donors should have a normal karyotype and a negative serology. And we can perform a study of recessive disease in the semen donors if the couple wants to make a better matching, okay? And in that way, we can avoid the apparition of any recessive disease like fibrosis cystica or other ones. How does this process work? First of all, we need to synchronize both women. Once we are stimulating one of them, we are going to prepare the endometrium from the other. The woman who provides her eggs undergoes an ovarian stimulation in order to produce follicles in an attempt to obtain an optimal number of oocytes. The stimulation takes about 10 and between 10 and 12 days. The women will inject hormonal treatment, and we are going to control the whole procedure with an ultrasound scans and hormonal blood test. Once the follicles have achieved an adequate size, that is between 16 and 18 millimeters, we will perform the pickup or the egg collection. At meantime, the receptor woman will prepare her endometrium. We are going to need a hormonal treatment too to prepare the endometrium, and it is with estrogens at the beginning. There are many different protocols, but we usually use a protocol with an increasing dosage of estrogens. And once we perform the pickup of the egg retrieval and we fertilize the eggs, she will start with the progesterone to finishing the preparing of the endometrium and have an adequate endometrium to improve the possibilities of embryo implantation. Okay. Once we have performed the egg collection, the biologist will select only the mature eggs, but because not all the follicles have an adequate egg inside. So once the biologists in the laboratory have selected the mature eggs, they selected to the sperm from a frozen sperm sample. After thought and capacity the sperm, the biologists select, first of all, the motile sperm, and then from this sample, they select the sperm which have a best shape. To fertilize the eggs, they will perform an ICSI, intracytoplasmatic sperm injection. They will introduce one sperm inside the egg, and we will wait to see how is the fertilization. Here you can see a human embryonic development, and once we have performed the ICSI, we have one cell fertilized, and it will start the cleavage into 2 cells, 4, 8 cells, 16 cells, and until achieve a blastocyst stage. This is the last stage of an embryo, and this is a stage where the embryo gets naturally the uterus, and all the process has been correctly. This embryo in a blastocyst stage will implant. Okay. Nowadays, with the new culture media and the new incubators, with most of them with a time-lapse system, it's more frequent to achieve, for the embryos to achieve the blastocyst stage. Not all the embryos are equal, not all of them have the same implantation capacity. It is going to depend on their development and their characteristics, their morphological characteristics. This kind of incubators with time-lapse system allow us to control the whole embryo development and select the best to be implanted. The embryo transference will be between 3 and 6 days before the egg collection and fertilization. It's going to depend on the number of embryos and their development. If we have only 2 or 3 embryos, maybe we will perform the embryo transfer on day 3 because the uterus is the best incubator that we have. But if we have more than 4 or 3 embryos, we will let them achieve a blastocyst stage. Okay, this is the embryo transfer. Here you can see an ultrasound scan. This is what you are going to see in the transference. You can see the bladder and the uterus. The embryo transfer are performed under a ultrasound scan to see where we let the embryos. Here you can see in the picture, the biologists will put into one thin catheter the embryos. Here you can see the catheter, and when we arrive to the entrance of the uterine cavity and we are in the correct place, we will introduce inside of this catheter or through this catheter once narrower who contains the embryo, and we let the embryo in the middle of the uterine cavity. This is not a painful procedure, and it takes about 3 or 5 minutes. As I resume, you can see here the whole procedure. First of all, we need to synchronize the both women period. We usually make this with a contraceptive pill. And once they have the menstruation, the ones who is going to donate her eggs, will start with the ovarian stimulation, and the other one will start with the preparation of the endometrium. Between 10 and 12 days after, we will perform the egg collection. The egg collection is not a painful procedure because it's made under sedation. We usually use anesthesia because we have to punch the ovaries, okay? When we have selected the mature eggs, we will perform the sperm sample selection. As I have said before, we select the motile ones, and then we select this sperm which has an adequate shape, and perform the ICSI in the laboratory, the intracytoplasmatic sperm injection. In that time, the receptor will be preparing her endometrium, first of all with estrogens, and from the egg collection on, we add progesterone, okay? Once we have cultured the embryos between 3 and 5 days, we will perform the embryo transfer. And if we have more than 2 or 3 embryos, we can vitrify the embryos that are not going to be transferred. 12 days after, the woman who has been transferred the embryos will perform a pregnancy blood test, and if it's positive, about 2 weeks after, we will perform the first ultrasound scan to be sure that the pregnancy is going on. Which are the probabilities of pregnancy with this technique? The probability depends on the age mainly, because a woman's eggs start to lose their reproductive capacity in a natural and irreversible process that tends to intensify from the age of 35. So people younger than 35 will have a higher probability of pregnancy. Here you can see that after the first attempt, the probability of pregnancy is about 65%, and after all the attempts of the same with the embryos becoming from the same cycle, the probability it's about 70%, and this probability will be reduced when the woman is older. We are talking about the age of the donor. Okay, the age of the receptor doesn't matter to the probability of pregnancy. In that way, if the donor is older than 40, the probability in the first attempt will be about 15%, and after all the attempts, if we have more embryos from that cycle, it can be about 20% more or less. We have another possibilities. We have the possibility that stimulate simultaneous both women in the couple, and we stimulate them. We collect the eggs. We can fertilize the eggs from both of them with the same sperm donor, and after the embryo culture, we will transfer the embryos from woman A to the uterus from the woman B, and embryos from woman B to the uterus to woman A. In that way, both women can be pregnant, and at the same time, if everything is correct and goes on, and both of them will be genetical and biological mother from the babies. Okay, so that's all that I have to explain to you about the Ropa method. Thank you very much for your attention, and we can pass to the questions if you want. Dorothy?
Yes, Dr. Carmen, thank you very much for this presentation. We have learned a lot. Okay, let's proceed to a questions and answer session. Okay, we have the first question. How long a couple should stay in Spain for the whole procedure?
Okay, as we have to perform an IVF cycle, we need that the couple stay in Spain between 15 days. This is because of the ovarian stimulation, okay? If you start with the ovarian stimulation, the first and the second ultrasound scan can be performed in your country, but the ultrasound scan previous to program the egg collection should be in Spain, and between this ultrasound to the pickup probably can pass 2 or 3 days, and from the pickup to the embryo transfer about 5 days more or less. So you need to stay between 8 and 10 days more or less, depending on how long the ovarian stimulation takes.
Thank you. Next question. Is there an age limit for the partner, egg donor?
There is no an age limit. this is going to depend. Okay, in Spain, we usually don't perform IVF treatment in women older than 50 years old. So this can be the limit for this kind of treatment too. But it's going to depend the most, or mainly, sorry, on the ovarian reserve and the quality of the eggs from the donor. And the receptor has not been older than 15. But yeah, we can see that this would be the limit.
Okay, thank you. Next question. I don't know if it's possible for you to answer, but it's bothering me. We live in a country where our relationship has no legal status, so we are not married. Is relationship status important and need to be confirmed somehow in the clinic in Spain?
Yeah, it's really important because as I have explained, donation in Spain is anonymous. So the only situation, the unique situation where we is not the anonymatus is not needed is in a context of a married couple. So we need you to be married to can perform the treatment, because if not, it would not be legal.
Okay, that's important information. Okay.
Yeah.
So only married couples, right?
Yeah, only married couples.
Okay. It doesn't matter in which country they are married, is it?
It doesn't matter, but they should be married.
Okay, thank you. Okay, and next question. We are a couple from abroad, the UK. What is possible time frame for us from contacting the clinic to starting the treatment? What about all the process afterwards? Synchronization, stimulation, etc. Do you have a clinic or doctor to recommend in the UK? How long does it take to choose the sperm donor?
Okay, too many questions. Yes.
Okay, I
I'm
think
going
we
to
have
start
few questions here.
for the
Okay,
first
one by
one.
one. Okay.
Okay. I will send you our mail address to contact us to start the treatment. Okay. The synchronization and stimulation is something that is not too long, as we need to synchronize both periods. We need start with the period from one of them, usually the donor, and we will give you a contraceptive pill in more or less number depending on where the periods become. But as long as the synchronization will take about a month to synchronize the both periods. When we start with ovarian stimulation, we start with the endometrium preparation too. So from the starting the ovarian stimulation to the egg collection will pass about 10-12 days, then the egg collection and data transfer. So from when you start with the pill to synchronize to the embryo transfer will pass about half and a month, more or less. Okay? We don't know, I don't know exactly if I have or if we have some doctor in UK to recommend, but I can ask about that. And choose the sperm donor is something really quick, because we only need to know your physical characteristics, and as the sperm sample are frozen and in a bank, we only need to look for a donor with the same physical characteristics than the receptor. Sorry. And select it. So this is something really quick. In 1 or 2 days, we can have the sperm donor selected. So this is the faster in the whole procedure.
Okay, thank you. Maybe I have one more question connected with the last one. So I understand that the clinic chooses the sperm donor. What if you have at least 2-3 sperm donors who have very similar characteristics to the recipient? Do you make that decision, or can the recipient couple make that decision?
No, our biologists take the decision.
Okay, perfect. And can we go back to the first question, because I think it was the question about the time frame from the moment a patient contacts the clinic to the moment when they start the treatment. Roughly, how long can it be?
We only need to have the mainly proofs, the serology and karyotypes, and blood test, an mammogram, a general blood test, and a blood group. Once we have the proof results, we can start. So it's not very long. If they have not a karyotype done, it depending on the laboratory, but it should take about 20-25 days in having the result. So once we have the whole results, we can start. It's quick.
Okay.
And sometimes we can start with the synchronization until we have the results, because they only have to take the pill. So they can perform the blood test, start with the pill, and we will have the results during the pill time, and then start with the stimulation.
And can the patients bring the test results from their home country?
Yeah, there is no problem.
Okay, thank you. Let's go to another question. I already had a 9th round of IVF. We are struggling a lot as a couple, but we keep on fighting. But more often, I have thoughts that I should say stop. I heard lately that hundreds of hormones I was taking would lead to cancer. Is it possible?
Okay, this is a good question. That is true that you have use high doses of hormones, and prolonged treatment with hormones can make higher the risk of having a breast cancer. But the age is the most important factor that increase the risk of a cancer. So the hormonal treatment can accelerate the procedure, but they are not going to induce you to have a breast cancer. 12 treatments are, I think, too much. So I think you should think about what is happening, or change the kind of treatment, or do something different, because something here is not working correctly. But the thing that increase more the risk of cancer is the age. Okay.
Okay, thank you. I just want to say to the person who asked this question that she's very, very brave, because 9 IVFs, she's a true warrior, I think. So yeah. It is hard. It is hard. Okay, let's go to another question. Can our sperm donor be our friend from a gay male couple? Is it allowed by the law?
No, because donation in Spain is anonymous. So neither donor nor you can know each other.
Exactly. Of course, the friend can't be a sperm donor at your clinic, but I guess there's no guarantee that she will receive the sperm. Am I right?
No, sure.
Yes. Yes. I mean, yes, it works like this. Okay. Next question. How should we decide about our roles? Who should provide the eggs and who should carry the pregnancy? We have similar test results. Okay, that's a very interesting question.
Very interesting question. Yeah. If you have similar test results, I think the age is the most important thing. If the tests are similar, the results are similar, I should advise you that the younger would be the donor and the older would be the receptor. But it depends, because if both of you want to be pregnant, if the results are similar, the advice would be, first of all, stimulate the older to get better embryos, because in 2 years probably the results are not similar, and then we will stimulate the younger to the older get pregnant.
Okay, yes, I think it's a good answer. The real problem is when the two ladies are the same age, but then I guess it's a kind of consensus between them. Yes.
If the age is the same age, they would decide if there is no problem in the uterus of none of them. I think it should be pregnant ones who has easy at work, maybe to have enough time to get a quiet pregnancy. If there are no difference between them in test result or in age, there is no medical reason to select one or another. It is the same. They should decide.
Yes, thank you. Okay, we have a couple of more questions. Does it happen often that transfer are cancelled because there was no eggs retrieved or embryos to transfer in egg donation, or because the donor and recipient cycles are not synchronized?
This is not usual if we stimulate a young woman with a good reserve. It depends on the reserve from the donor. If we had a good reserve, usually we have good embryos, and it's not usual not get embryos to transfer. If the donor is older and or the reserve is not adequate, sometimes there is the possibility that we cannot have embryos to transfer. It depends on the number of and the quality of the eggs that we start. For example, if we have a donor with 20 follicles or 15 follicles and with 32 years old, it's really difficult not to get embryos to transfer. If we have a donor with 40 years or 4 or 3 follicles when we start the stimulation, in that case, it is possible to not to have embryos to transfer. And it's not usual that we have to cancel a cycle because of the synchronization, because we usually start the receptor protocol a little bit before to be sure that we are going to have enough time to prepare the embryo or the endometrium, although it takes a little bit more time. So this is not a usual situation.
Thank you very much. We have another question. What tests we need to or can do in advance and deliver to the clinic to speed up the treatment to maximum?
Okay. We need a serology from both of the women, and we will need an ultrasound scan with a counting of antral follicles from the donor, and an ultrasound scan to evaluate the uterus and the cavity from the receptor. From the donor, we will need a karyotype and an anti-Mullerian hormone, and blood group from both of women, and I think that's all.
Thank you. I have a question. I would like to go back to the previous one. I'm thinking, do you do any guarantees? Do you guarantee a number of eggs or a number of embryos in the Ropa method program that you have?
In the Ropa method program, depending on the age of the donor and her reserve, because this is what is going to make the difference. If we have a young donor with a good reserve, we can guarantee 2 or 3 blastocysts. But if we have not a young woman, or the reserve is not adequate, or we have any illness like endometriosis, we cannot guarantee a number of eggs or of embryos, because it is not possible. Okay, so depending on the age and on the reserve, ovarian reserve.
I see. So if I'm a patient and you know my test results, then you can let me know if you can guarantee 2 or 3 blastocysts for me.
Yeah.
Am I right? Okay. Yes, we have some more questions. I'm curious and I want to be sure, is Ropa the same as reciprocal IVF? I've been doing some research and I found this term, and now I'm not quite sure if it's the same thing or just a language thing. Thank you for explaining.
Okay, it can be the same. This is that we have that I have showed you in the last picture. A reciprocal IVF cycle will be when we stimulate both women at the same time. We produce embryos from both of them, and we transfer the embryos from the woman A to the woman B, and the embryos from the woman B to the woman A. Ropa is only the general method. It does mean that we stimulate one woman, we get the eggs, we fertilize, and the embryos that we obtain are transferred in the other woman. So, and reciprocal IVF will be like a double Ropa, more or less. I don't know if I have explained it correctly. Do you understand it?
I think you have. Let us know in the comments, the person who asked the question, if this answer is okay for you. If not, we can ask Dr. Carmen to give some more explanation. Yes, it's okay. Yes, perfect.
Perfect.
So I understand these two programs also differ in price. Is reciprocal IVF more expensive because we have 2 stimulations? We have is it more expensive then?
Yeah, a little bit more, because we have 2 stimulation, and we have to perform 2 ICSIs, and we have to culture more embryos. If not, I think it's not. I cannot tell you exactly how much it will be. I'm sure that it would not be like 2 Ropa, but probably it will be more expensive than only one.
And they can use the same sperm donor, right?
Yeah, we can use the same sperm donor.
Okay. If you have any more questions, please type them in the chat section. We can wait a bit for more questions. Dr. Carmen, maybe in the meantime, while we're waiting for questions, I was wondering if you've had a Ropa case that was successful or maybe difficult, and something interesting you can tell us about some success at your clinic.
Yeah, we have now along this year we have performed 4 cycles from Ropa, and 3 of them are pregnant now.
Wow, fantastic.
So we are happy with that.
Okay,
it is not more difficult than an IVF cycle. It's easy to carry out. So if some of them have performed an IVF cycle, they will know how does it work. It's not a difficult procedure.
It's not? Okay. I don't think we have any more questions for the time being. No? Okay. I think you have answered all of them.
Perfect.
Okay. Good. Okay. Thank you very much,
Thank you very much
for
too.
the lovely presentation and answering the questions. I think everything is clear now. Of course, if anyone has any more questions, you can contact us, Examination Friends, or the clinic. Remember that you can subscribe to our channels, you can subscribe to our YouTube channel, and you will be notified when this video from this webinar will be uploaded on YouTube. You can also check our Facebook fan page and our Instagram. Dr. Carmen, thank you very much. It was lovely to have you.
Thank you.
Thank you, all attendees, for your attention, for spending the evening with us, and we wish you all the best in your future treatment. Thank you very much. Good night.
Bye-bye.
Bye.